We are honored to welcome back to this show three of our most esteemed guests. Jimmy and JoAnne Moriarty and I are honored to be joined by retired State Senator Richard Black. Welcome everyone back to the program. How are you all tonight?
Very good.
Here. Very nice.
Great to be here, yep.
And Senator Black, thank you so much for taking time out of your schedule. You know, of all the guests we've had on Crowdsource the Truth, no other really has your experience, your resume. You're a decorated member of the United States military. You're a Vietnam veteran. You're a lawyer. Of course, you were part of the JAG Corps. You've been a state senator. You're a diplomat, and you've got really important insights into these public health policies as both a politician and someone who has been on the ground. Tonight we're going to be going over some questions. Where would we like to begin?
Well, let's start with the first question, number one.
Right.
Okay.
Excellent point.
Senator Black, this is the first question that you would like to discuss with us. Now Democrats are criticizing Trump for being late in response to coronavirus. How adequate are the Trump's actions towards the coronavirus?
Yeah, let me just give a little background. You know, it seems like the virus is peaking at this point. They're looking for the crest to be on Easter, April the 12th. And already the model, which was predicting, I don't know, 100,000, 200,000 deaths, it's dropped down down to 60,000. So that gets it kind of in the range of a pretty severe year for ordinary flu deaths. But anyway, that's where we stand now. We've got to get the economy up and going at some point. And we got the problem. We've got this Dr. Fauci, who is he's the consummate pessimist. And he would leave everything closed until we starved to death, and then nobody would die of coronavirus after that. But
that's right.
Problem solved.
And today he made the comment. He said Americans should never, ever shake hands again.
Yeah.
If they won't spread anything. Well, I got to tell you, people have got to live. They've got to be human. We're not on this earth just to see if we can survive an extra 10 days or so. We want to live. So it's kind of crazy. Now we've got Peter Navarro, who's a past very radical Democrat. I don't know why Trump didn't purge these guys out, but he didn't. And this guy he's prescribing hydroxychloroquine. I'm not taking a position. I don't know whether it's good, whether it's not, but that's put him in conflict with Fauci. So you got these two characters, and they're kind of in conflict. But anyway, I think the president's instincts have been fairly good, that we need to get back to work as soon as we can. And the great dilemma is the president's under a lot of pressure from people who say, oh, if you start early, then somebody's going to die. And they're right. I mean, somebody's going to die because we start early, but people are going to die if we don't start early. That's a problem. So, the question came up, well, how well is Trump doing? Has he done well? And I kind of went back and I looked at some of the timeline on this. Very interesting. But the first death in the United States was on February the 29th. And 29 days, almost a full month before the first death occurred, the president had declared a national health emergency. A month before one person died, he declared a national health emergency. And the same day, we knew there was a real outbreak in Wuhan, China. And so he restricted entry coming in from China. And it was kind of interesting. that 5 days after he restricted China from coming in because of all of the infections out of China, the New York Times had a front page article entitled "Racism is at the Heart of Trump's Travel Ban." Now, today, these are the same people who are jumping all over Trump saying, "Oh, you didn't start early enough." Well, he started a month before we even had one person die in this country. And when he shut down the flights from China, it rocked the stock market, and it rattled industries that relied on parts and so forth. And then about 2 weeks after the first death occurred, he cut travel from Europe, most of Europe. 2 days after that, he cut travel from the United Kingdom also. And so interesting. Now, the New York Times, I mean, they kept sort of going slow. And on March the 20th, now this is after we had people dying in this country, and we also had infections coming. And they asked the reasonable question, is our fight against coronavirus worse than the disease? And they recommended herd immunity. In other words, just let it rip, let people get it, and maybe we'll get immunity. That may not be all that wrong. But the point is, if you're going to say that, then don't turn around and accuse the president of not being tough enough on it. It's the hypocrisy that's crazy. But if you look, here he is, 2 weeks after the first death, he passed the first emergency bill through the House. And then a few days after that, he signed this $2 trillion emergency coronavirus spending bill that paid sick leave, free testing, protected small businesses. And now we are on the verge of spending about $6 trillion. Now, again, what I'm saying is that Trump took extremely forceful and extremely prompt action. I'm not saying that this is what I would have done. When we look at $6 trillion, I think Jimmy and JoAnne are well aware that $6 trillion is about what the United States has spent and wasted in 30 years of fighting this Mideast war, the war against the Mideast. Not a single thing's ever been gained from it. And yet, if you look at, we spent that over 30 years, and we are spending that on the economy literally in a period of weeks. So it's an astounding amount of cash going into the economy. So I don't think anybody can complain that Trump was either slow or that he was not sufficiently forceful. You can question the wisdom of some of the things, but not in terms of being slow or not forceful enough.
You know, well, Senator, it's interesting. Sorry to interrupt you there, Jimmy. We've been looking at the New York Times quite a bit, and they've contradicted themselves, even within the context of their own articles. Once we get through the questions that Jimmy and JoAnne have for you, I'd like to come back to that and share some things with you that you might find quite surprising.
Yeah,
sure.
Yeah, for sure.
Well, you know, when you have advisors like Trump keeps around him, that's something that's a conundrum for us. You know, JoAnne said that every time she sees Fauci, she sees the south end of a north-facing horse. So, you know, bad guy from day one.
I didn't say that.
He's a bad guy. But, you know, how does Trump keep these bad advisors around him? And, you know, in spite of that, you know, he still is trying. But, you know, you don't think he's got much control because how could you keep these people around you if that's your best advisor? Yeah, Fauci's a bad guy.
You know, Jimmy, during the campaign, you know, Trump talked about a lot of things he would do and he could do. And one of the glaring deficiencies, he used to say over and over, he said, I may not know about this or that, but I know how to pick the very best people.
Yeah,
I would give him an F on
absolutely.
Yes,
Yeah.
absolutely.
that. You know, when he came in, one of the first things that any new president does is he issues the Plum Book, and the Plum Book has all of these Schedule C appointments that they give out. There are about 5,000 of them, and it allows the new administration to insert its people into low-level policy-making positions. And from there, they're the eyes and ears of the new administration, and they also are in position to where ones that really shine, they can move them up, put them in higher positions. He never did this. It's the only president I'm aware of that did not put out a Plum Book and did not replace the Schedule C appointments that were put in there by Barack Obama.
That's a conundrum.
That's
Wow.
yeah.
To what extent, if
Okay.
I might ask, Senator, do you think that's because he's been unable or unwilling? I mean, it seems to me there was a very definite point where President Trump shifted from, as you're saying, and frankly, I've discussed it with multiple MDs who, when they first rejected this concept of herd immunity, I spoke to doctors who felt that it was medically unsound to lock everybody in their houses and that we would actually be safer if people with normal immune systems were allowed to conduct their regular lives. Some people would get sick and would recover, but as you pointed out, this would develop a natural herd immunity, and it would have allowed the economy to continue while the most vulnerable members of society could isolate themselves and stay home.
Well, you know, it's kind of you can see both ways. Now, by doing what we've done, which is historically unprecedented on this level, we've reduced the number of coronavirus cases. Now, the season is coming out to an end. Flu season comes to an end, and it looks like that's going to cause this taper off. But if it ends, I don't think it necessarily ends because we did the social distancing. We have fewer cases because we did social distancing. The problem is we don't have the herd immunity. So it comes back next year. Now, what do we do when it comes back next year? We can't close down the economy again. At a certain point, literally, there are going to be people starving, and you just can't do it. So
Senator, that gets us into our next question. You know, this virus has been compared with September 11th, Pearl Harbor, etc. What do you think about that comparison to all those really huge, horrendous events?
You know, I remember when 9/11 hit, which was a very, very big traumatic thing, and they compared it with Pearl Harbor, and I said, this is not Pearl Harbor. I mean, I don't care, you know, you can count the numbers of dead and so forth, but in terms of the shock wave that it sent, you know, Pearl Harbor was before I was born, but it wasn't too long before. And if you look at 9/11, people have kind of forgotten 9/11 ever happened. I mean, here we are. We've been, ever since 9/11, we have been closest of allies with Al Qaeda in Syria, and those are the people that flew the planes into the Twin Towers. And
those are the people NATO supported in Libya.
Yeah.
Yeah, and they, when the Twin Towers went down, what did we do? We built a mosque on the site of the Twin Towers as a way of the radical Islamists spiking the ball and saying, okay, we killed you guys, and here we are. Now we're sitting on top of the pile of rubble. it's astounding how little regard the politicians of this country have for the people of the nation. And the fact that we've been allied, we've been arming Al Qaeda, we've been sending them into battle, we've given them diplomatic support, and all of the things, it's just insane. But anyway, well, back to your question here. Pearl Harbor was a very dramatic thing, and this coronavirus flu, it's a serious health issue, but it's no Pearl Harbor. To date, it looks like we are likely to have a death rate about half of what we had with the swine flu. Now, it still has to play out, could be wrong, but it looks like with the curve and everything, we're probably looking about half the death rate of the swine flu. Now, that was just back in 2010.
That was under Obama.
Under Obama, well, see, nobody cared because it was Obama. You could see no evil, hear no evil, do no evil. It was Obama. He's sort of the next coming of the Messiah. So nobody talked about it, and nobody really noticed it that much, and it just passed. But it was probably about twice as bad as coronavirus. You compare with the HIV epidemic, which started in 2012, and it's dwindled, but it still goes on to this day. That thing is literally hundreds and hundreds of times larger than what coronavirus is. So somehow the overreaction to this.
There's another agenda. I think there's some other agenda going on. That's why. Senator Black, you can go back to the Black Plague. There was no vaccines or medicine, and nobody even knew what caused it for a long time. I don't know how many people died, millions of people died from the Black Plague, but humanity got through it. They got through it. In other words, we have these viruses that are on this planet with us. From time to time, we have outbreaks of different ones. But you have to gain your immunities to them. You have to move ahead with your life. If you stop every time everybody gets sick, you won't be doing anything.
Well, what's bad is that we've set a precedent now.
Oh, yeah.
For a relatively, it's not an insignificant event. It's one of these blips in the annual flu deaths. Which range from 12,000 to 61,000. This is going to be one of the higher peaks, but at the same time, it's not that exceptional. And what's happened has been greatly magnified by the presidential election, because you had this ratcheting thing where Trump said, "Okay, let's don't overreact," and the Democrats said, "You're not taking it seriously." And then he's, "Okay, well, I'm taking it more seriously than you are." And back and forth and back and forth. And before long, we've just driven it up to the sky where, you add $6 trillion to the national debt in this time. This is the shortest period of time, I think, in history that we've ever added that much to the debt. Even going back to the 2007 financial crisis, I'm not sure that we were pumping out money at the same rate we are today. We're just, the whole institution is starting to shudder and shake, and some of the wheels are starting to wobble and threaten to come off the machine. But that's been a problem.
Well, Senator, on top of that, the Fed had been pumping $1 trillion a day into their banks. And of course, the taxpayer here is obligated for that. So this $6 trillion is just a small piece of the money that's been pumped up to subordinate the crashing markets and everything. So, it's you have to look put a real critical eye on what's the real cover-up. Nobody in their right mind would kill the economies worldwide like has been done over a virus. Like you said, it's a seasonal flu type event. And you know, when we were kids, all the neighborhood mothers, when a child got the mumps or measles, the infected child, all the neighborhood kids were brought in, so they would get it and have their immunities before they were older and really suffered from it. And by isolating everybody, it removes that opportunity for the antibodies to be developed.
Immunity.
And as all the doctors have said, this virus is one that 70 to 85% of the people won't even know they had it.
Yeah.
So, you know,
get it, and it's just like a little sniffles or something.
Yeah.
Yeah, some don't even have any symptoms.
Yeah. Well, I don't know. I worry that we're going to be faced with it next year. And, you know, it's like these things, they come back each year. They don't just disappear. And what
We can't panic every time.
We
What
can't-
what about the 27 million that don't have insurance? People are asking about that.
Well, you know, I think the administration's dealt fairly well with this thing. They've under the legislation they did, the federal government is going to cover the uninsured patients for their coronavirus treatment. And what they're doing is the providers are going to be paid under the Medicare reimbursement rates. The largest insurers under Medicare are Cigna and Blue Cross Blue Shield, and they have agreed to waive all the copays. So that means if you get it and you're in the hospital,
Save $50.
Yeah.
Yeah, but you know, I think they're worried about having people have to pay anything, and so so I think they've covered that fairly well. You know, some people say, "Oh, well, what about this particular thing?" When you're dealing with something of this magnitude, you're bound to have some little gaps. But I think they've handled that pretty well.
Well, Jimmy, JoAnne seem frozen. Have we still got you guys there? Jimmy, JoAnne? I think we've lost them for a moment, Senator Black. Let's see if they...
How about if I continue? I've got the next question.
If you could, please. And hopefully Jimmy and JoAnne will return.
Okay. Yeah, there was a question about why can't the healthcare system in the richest city of New York overcome the epidemic? And why is there, you know, why are there more infections among blacks? And I think basically with New York, you had an odd situation. Governor Cuomo came out and he made an odd statement. This was on March the 2nd, so it's early in the game. And he said, "Excuse our arrogance, but I think I speak for the mayor of New York City when I say that we have the finest medical system in the world, and I don't think we're going to have nearly the problems that other cities have." Well, of course, he was very, very wrong. They have the biggest problem, I think, right now on Earth. And the fact of the matter is that there's no magic wand. It doesn't matter if you've got good health care. But the problem is that New York is probably the most international city on Earth. Tremendous numbers of people fly in. They fly in from China. They fly in from Italy, from all kinds of places. They bring infections, and also China is or New York City is a very social place. People go out there, all kinds of restaurants. It's a very compressed area. People live in close proximity. People go to Broadway shows, and I was thinking about the New Year's celebration that they have, where hundreds of thousands of people crowd into the street, and I'm sure that they were in there with a lot of people who were infected with coronavirus, and there was no social distancing back then. So I think that's why we have such a problem in New York City. But there's recently been this question raised about whether there's a disparity in the infection rate and the death rate with blacks, and I think there really is no good statistical information. There's a lot of anecdotal things, but fact of the matter that your African Americans live in cities where people live in much closer proximity. The African American community has a much higher rate of obesity, high blood pressure, and diabetes, which are all risk factors for the coronavirus. And to some extent, healthcare professionals are more reluctant to work in neighborhoods where they may encounter violence. But I thought it was interesting. I looked at the numbers for New Orleans, and in New Orleans, about 60% of the population is Black, and about 70% of the deaths were Black. That kind of surprised me because I thought there would be a greater disparity. If you look at New Orleans, they have a lot of service workers, people who are waitresses, people who work in hotels, people who work in small businesses, sometimes
Bars
outdoor
and things, yeah.
Yeah, sell flowers, whatever. And then the mayor of New Orleans made a decision to conduct Mardi Gras. There were people advising against it, but the mayor said, no, that's
I
their
think
big.
Jimmy and JoAnne are back.
Oh,
We're
okay.
back.
Okay, sorry,
I
Senator.
don't see us though, Jason. My
Yep.
camera's on.
Give me just a second. I'll get you guys back on there. Senator Black,
Sorry
if
about
I
that. Our
could,
net went down.
how many more questions do we have to go through? Because I want to have an opportunity for the senator to answer the questions. But there's some things I want to share with you, Senator Black. Yeah, we don't have video on you guys, Jimmy and JoAnne. Can you toggle the camera?
We'll move on when you're ready.
Go ahead, Senator, and y'all continue, and we'll try to.
Yeah, if you guys can get the camera back, we'll work on that. So the thing I wanted to say, Senator Black, is that, I think that obviously there are some things that people are feeling like things aren't normal, as you're pointing out. And as the president said at the outset, obviously the coronavirus is different biologically than influenza, but the numbers, the susceptibility, the sickness, it's on parity. There are people who are going to die, people who are immunocompromised, who are in the hospital, who have breathing problems and things. But the response around New York City, I think it has nothing to do with the quality of the healthcare system. It has to do, in my view, with the incompetence of the people running the city. Because I've been going around, a lot of people have been watching Crowdsource the Truth and have seen me going around. Several days I've walked by this depot. Can you see it here on the screen share, Senator? We've got 11 ambulances parked here at the FDNY depot. This is, I think, number 7. I presume they have others. I have seen so many idle ambulances around New York City. And of course, there could be a number of reasons for this. It's also possible that people are getting to area hospitals not by ambulance, but it begs the question, why is Bill de Blasio getting 250 additional ambulances from FEMA if there are all these ambulances around? And I've spent the past 3 weeks talking to EMTs, to ambulance drivers, to doctors, people hanging around the hospital. And basically what we've seen has been a dramatic contradiction of some of the things that we've been told in the mainstream media, whether it be the New York Times or CNN. The New York Times has been, I think, a major culprit in what I'm going to come right out and call fake news. This is a story they did about a Brooklyn hospital. This is Maimonides Medical Center, which I visited yesterday. The article is written by Pulitzer Prize winner Sherry Fink. And I don't know how the process at the New York Times works, what Ms. Fink may or may not know, where this information comes from. But I wanted to point out to you this very interesting element of the story. So sorry to be scrolling through it so quickly, but we see this individual on a gurney in the hospital. Now, there's a lot of restrictions about photographing patients in hospitals. I've spoken to lots of MDs who I know personally, members of my family who are medical doctors and doctors who I've visited. This is allegedly Dr. Yi Jiao Fan, and he's an oral surgery resident at the hospital and a confirmed case. He was isolated at home and getting better, but he began coughing blood. Now, this guy looks to me like he's perhaps in his 30s, maybe his 40s. Coughing blood is a pretty serious symptom of illness. I mean, I've just turned 48, and if I were to cough up blood, I would definitely contact a doctor. The thing that's so strange about this, Senator, is that, I went to the hospital, Maimonides, and I want to show you that. Let me get to this point in the video. The issue is I spoke to some individuals who were leaving the hospital, and I have to say, an eagle-eyed viewer on Crowdsource the Truth pointed out that this guy who was walking out of the hospital under his own power, he looks remarkably similar to the individual in the photograph in the New York Times. I think I'm about to show it here in the video, but I want to bring it up for you so you can see it clearly, and I'm going to be making another video about this because this is remarkable. People are concerned about fake news, and I'm sure you're well aware, sir, that in 2014, Barack Obama approved of this National Defense Authorization Act that included a Smith-Mundt modernization bill, which essentially legalized the use of propaganda against American citizens and would allow the New York Times to engage in a propaganda campaign. It wouldn't even be illegal. So here, I've got it right here. This is the segment of the video where, let's give a listen to this. Let me see if I've got it set for audio here. I'd like you to hear it. Let's see if I can make this work, hopefully. So this woman comes out, not hearing it for some reason. There we go. We're not getting the audio. But this is the guy right there. He looked remarkably, I'm going to make a video that will display it more clearly, but he's wearing what appear to be the same exact glasses. And when I asked him if he worked in the hospital, he said no, and he doesn't speak English. I find it difficult to imagine that an oral surgeon who doesn't speak English could work in this hospital. It's not a predominantly Chinese neighborhood. Perhaps if the guy spoke Hebrew and not English, he might have a career in this particular hospital. But I think it would be quite strange to have a doctor there.
Is it overrun in there?
There we go.
Is it hellish? Apocalyptic?
You could ask them. It is apocalyptic.
Are you a doctor? Not a doctor? What do you do in the hospital? Don't speak English.
He doesn't know English. What do you think about a nurse laughing at the question, is it apocalyptic inside there? I would imagine someone who is dealing with a serious medical emergency like this. I mean, Senator Black, I have no experience in the military. I have no experience in these life or death situations. But in my previous industry, filmmaking, there were times that we were under the pressure of a deadline, and I certainly spent 30, 40 hours awake to get a job finished, and you could see it on my face when I was stressed out from that kind of work. I would think somebody working a 16-hour, 20-hour shift would not be laughing, would not look, fresh with the makeup and all that. What do you make of that exchange outside the hospital?
Well, I want to touch on one thing. You mentioned all of these ambulances. I've been to medical facilities several times during all of this. A friend of mine went to Inova Fairfax Hospital, went to the emergency room, which is usually just bedlam with people crawling over each other. Not a single person was in the hospital. And I've gone to the urgent care center. I went there, I was there for about an hour and a half, and there were a total of 3 people, including myself there. So medical facilities are underused all through the country right now. It's unprecedented. They've never seen as low use as what they're seeing today. So it's kind of unusual. If we're in this mammoth medical crisis and yet all the medical facilities are empty, what's going on? I don't understand that. So that's something. And you know what you saw with that one person being wheeled in, I don't know the details, but I don't put it past the media ever to stage something. If they want to make a point, they create a point, and they do this all the time.
We're back.
Senator,
You guys are
Yeah.
back. Okay, let me bring
Through a
Jimmy.
glass darkly.
Yeah, our net got hit and it blew the camera.
knock the camera out.
Huh.
Senator, Sunday, we had our refrigerator go out, and so we went on Craigslist to buy a used refrigerator, something we could afford, and we ended up buying one 120 miles from here, North Houston,
Mhm.
and right at the intersection of I-45 and Texas 242, there are three huge hospital complexes. There's Methodist, there's Christus, and there's Texas Children's Hospital. And so we from the overpass, we could see that the parking lot in one of these big complexes was empty. So we dropped off, drove in there, and the employees' parking lot was empty. There were two cars in front of the entrance of this 15, 20-story hospital, where there are 8 or 10 big buildings in that one complex. One person in the lobby. We decided to go look at the others, and we went across the highway to Methodist. Again, nobody in the parking lot. Oh, we went to the emergency room of that hospital. Nobody there. 2 ambulances parked outside, not a soul in sight. Went to Methodist, same thing. Went to Texas Children, same thing. And normally, those you have to drive around to find a parking place.
Yeah.
You know,
And nobody was there.
Senator Black, we have a good
Mhm.
friend who had to have eye surgery down at the Veterans. He's a Marine Corps veteran, lives in the Woodlands, Texas, and he contacted us. He said, you know, I normally go to the veterans down there in Houston. It's the biggest VA hospital
One of
in
the
the
nicest ones.
United States.
Mhm.
And he said it's always packed. You can never find a parking spot. You have to get there early. He said, you can't believe how empty that place is. He said, there are cars there, but like 1/10 of 1% of what there normally is. And he said, I had to have eye surgery, so it was a checkup and I could go in, but he said there was nobody at the VA, which was very odd, you know, for him.
Well, this is more than just a few isolated examples where you say, well, maybe it is, maybe it isn't. I think we've seen enough examples from different parts of the country to show that the medical system, rather than being overstressed, it's actually having some financial distress because they're not doing the normal things that they do. Everybody's locked down. I've actually heard that medical people are under some financial stress these days because they don't conduct their normal surgeries and things that happen. So, you know, I can't imagine if we were faced with the cholera epidemic or the Black Plague or something, I can't imagine medical facilities being unfilled.
You know, I'd like to
No.
introduce you, Senator Black, if you are not yet familiar with Dr. Colleen Smith. She first came to my attention in this New York Times piece, I guess it was almost 2 weeks ago. It was March 25th. And, you know, she has this very dramatic, kind of breathless video where she's saying, oh my God, the ventilators, we don't have enough ventilators. In the video itself, while they're showing video and playing audio of the doctor informing us of this dire condition, there's a text overlay that says the hospital officials have denied that there was ever a moment where they almost ran out of ventilators. The following day, New York Governor Andrew Cuomo said there were something like 10,000 ventilators in a stockpile, but the hospitals didn't need them. So I contacted Dr. Colleen Smith. We've learned quite a lot about her. Her LinkedIn profile says she's an expert in medical simulation, and I've watched a lecture that she gave on simulating trauma. Now, why would you want to simulate trauma? I think everyone in the United States has been traumatized by this event. And my question for Dr. Smith that she's refused to answer, I mean, she said it's not a simulation, but there's a lot of reasons to disbelieve what she's saying. The New York Times, shortly after this, when I began questioning the doctor publicly and kind of doubting what she said, they released a tweet that said that the doctor is coronavirus positive. So I contacted the official media outlet for the hospital to ask them what their policy is once a staff member becomes coronavirus positive. So we've got one doctor here that the New York Times reports as coronavirus positive, another doctor allegedly in Borough Park, Brooklyn, who's vomiting blood and walking out of the hospital possibly a few days later. My question is, what's the official policy if we have doctors seeing patients who may or may not have coronavirus? I think we would want to isolate these doctors, but they won't answer, Senator. They have failed to respond to multiple phone calls, emails which have been confirmed received by a woman named Ms. Butler, who I was initially told was the media contact. Her LinkedIn profile says she's the brand storyteller for the hospital. And after 48 hours of no response, when I called her, she said I needed to speak with the person who is the media contact for the whole of the NYC health and hospital system. Guy by the name of Chris Miller, who I've now emailed twice, called countless times, no response. It's very strange, Senator.
Well, there are odd things go. You know, the people, the public are constantly manipulated. Now, I did see two articles today. One said that Cuomo decided they had too many ventilators and he was shipping 500 out of state.
Wow.
The other, yeah, so the big crisis seems to have ebbed. The other one said that that New York City, before this thing started, had a great surplus of ventilators that they didn't want to bother keeping up to date, so they sold them. This is before the thing started, but they had stockpiled them under a previous administration to handle something just like this, and then they sold them all off, got rid of them. So, for Mario Cuomo to be crying the blues and sending out panic messages, just totally unreasonable what he's doing. The question should be asked, why did you sell off all of your ventilators just before you had this coronavirus process?
At a penny on the dollar. And then the next question is, whose cousin or uncle or brother is going to get the contract for those 250 ambulances? Follow the money, especially in New York.
Absolutely.
Yeah. Senator, I think it's also interesting how the cases of pneumonia have gone down in the same rate that the cases of death for coronavirus have gone up. So you
looks like coronavirus is curing a lot of diseases.
Well, I tell you what happens, and and part of this is just human nature. But, doctors are human beings too. And they'll talk to families, and somebody dies of pneumonia and the family is just distraught. And they say, oh my gosh, doctor, this must have been coronavirus. And the doctor, he just kind of goes with, yeah, it probably was. And then the next thing, he marks it on the death certificate. If it makes them happy, fine. But my guess is that we've got an enormous amount of over-reporting of coronavirus, where it's actually either common flu or just ordinary pneumonia.
Yeah, people die from heart disease. They die from all different kinds of things, all the time.
Yeah, and there's a difference between dying with coronavirus and
Yes.
dying of coronavirus.
Yes.
Take it as an extreme example. Let's say that I've got coronavirus and I'm feeling real bad and I'm coughing, I got my mask on and I walk down the streets of New York and a mugger comes up and blows my brains out. It's possible I may go down as a coronavirus victim, but I didn't die from coronavirus. I died from a 38 slug in the head.
But
Now-
their wording is real tricky. They say died after having been diagnosed as having
Complications
coronavirus.
from
So, you know,
coronavirus.
it's-
they say.
Now that's obviously an extreme thing, but you have a lot of other things. A friend mentioned to me a baby, a 3-year-old boy or something, and he was diagnosed with coronavirus and he died. Well, children often die of sudden infant death syndrome. There's no way to diagnose or anything, but a certain number do.
Mm.
Are the chances not better that that's what happened than that he ended up being 1 in a million who died of coronavirus? My guess is he died with coronavirus, but he did not die of coronavirus.
Yeah.
Can we
And-
talk about Libya for just a minute? Because I don't know.
Could you guys
Jason,
adjust the focus on your camera? I've been meaning to.
Not really. This is a
Wait,
backup.
no
it's a
problem.
backup
No
camera.
problem.
I can try.
No, that's okay. Let's talk about Libya. But there's actually still some more coronavirus stuff I want to share with the senator, because I think that most people have been getting their information from the mainstream news, and as the senator is pointing out, this is often a very deceptive medium. You know, we were talking about follow the money, and there's a lot of money being spent to build this triage hospital at the Jacob Javits Center. All the labor is being done by the Carpenters Union. I saw trucks from medical supply companies bringing stuff in there. So it seems like rather than redirecting ambulances that are already owned and operated by the FDNY or other services around New York City and New York State, Andrew Cuomo was very quick to start funneling this $2.2 trillion to, as you pointed out, Senator, very likely special interest groups around New York City who must be quite pleased that Andrew Cuomo's policies are directing money towards them. When I've asked these Army, service members who are working at the hospital, understandably, they don't have too many answers for me. There was a very upsetting conversation I had, unfortunately, after I ended this stream and I was walking home. There were 2 gentlemen, maybe they were 20 years old, wearing military fatigues. My camera was not out, so I was just a person speaking to them on the street. And I asked them if they worked at this Javits Center triage hospital. They said yes. And I asked them if there were a lot of patients in there. They said they didn't know. They had just arrived. I said, it's interesting, everybody I'm speaking to over there doesn't know if there are patients there or not. And one of them said to me, I don't care, I'm getting paid. And this is a member of the military. The guy was 20. I mean, this was so disgraceful to me that he would have this attitude while citizens of New York City are basically going broke, losing businesses that they've had maybe for, 20, 30 years or more, generations old businesses. I also had this very unpleasant exchange with some Marines at the USNS Comfort. I was trying to ask them if some things I had seen in a documentary about the capabilities of the ship were accurate or inaccurate. I heard that the ship is incapable of conducting open heart surgery, just I guess because of the complications of that type of surgery and the nature of a ship rolling around. And, given that heart disease is one of the most significant killers of people in the United States of America, spending all the money to bring a boat here to New York to handle everything but coronavirus that cannot handle what is probably the most urgent and needed service seems straight dumb to me. And this Marine was so unprofessional and rude that I asked if there's a commanding officer that I could speak to who could answer a question. They brought over someone who told me to Google public affairs. And I mean, I said, is there like a Marine website that I can go to actually contact someone and ask this? And the guy, I mean, I felt like I was talking to some high school jackass who was just shining me off and basically telling me to take a hike. I took great offense to that, Senator. I have tremendous respect for veterans of our military, yourself, my father, my uncle, a lot of people, but I do not believe that simply putting on a military uniform automatically gives someone respect. And if these guys are going to come to my city and invade it with military equipment and refuse to politely answer honest questions, I frankly want them to get the hell out, Senator. I want to know what's going on over there with that boat.
I think the ship was more symbolic than anything. Again, the president's under a lot of pressure. He wants to show action. I think somebody mentioned, oh, why don't you send a hospital ship? All right, send a hospital ship. I'm not going to get in a debate about whether it's wise or not wise. I'm going to send a hospital ship to where you can't spend the next 3 years complaining that there wasn't a hospital ship and it would have saved umpteen lives if we had sent it. I think that's what's going on. There's a very pernicious political dynamic at play to where people just throw money at things and they do things just to appear to be doing something. And you can figure, okay, if there's a $2 trillion aid package, you can probably count on it that at least 1 trillion of that is pure corruption.
Pork.
That's going to line people's pockets. It's going to go into Swiss bank accounts. That's just the way it is when you've got massive quantities of money going out.
That's unfortunate, isn't it?
It is. I mean, it's just like what's going on with the Mideast war.
Yeah.
We have people who go over there. Like in Iraq, 2 weeks after we invaded Iraq, people were complaining that the electrical grid was out. They couldn't get air conditioning. When they recently had riots back, 9 months ago or so, one of the principal complaints, the electrical grid's not working. We don't have power. Saddam Hussein powered up Iraq. He didn't have a problem with it. But we destroyed it during the shock and awe, and we never rebuilt it. But there have been plenty of contracts to rebuild it, just nothing has happened because the money from those contracts goes to Switzerland. And, there's considerable fear that at some point the mountainsides are just going to fall and there'll be a huge avalanche filled with money, with American dollars from the war in the Middle East, just money rolling down the hillsides of the Swiss mountains. Corruption is like that. When you start dealing with huge amounts of money, it goes out as corruption, and that it lines people's pockets.
That's
No
right.
doubt. And it seems like Andrew Cuomo is totally on board for that program, utilizing the New York Times, the New York Post to put out inflammatory stories, particularly with the New York Times, that are going around the world, getting re-reported in England and elsewhere. I want to turn our attention for a minute, Senator, to an individual who came up earlier today. The president commented that Dr. Tedros Adhanom, whatever his last name is, the guy who's the director general of the World Health Organization, he's not only a member of a Marxist political party in Ethiopia, and he's been tied to a number of medical scandals through the Clinton Foundation and vaccines coming from the Bill and Melinda Gates Foundation. This is an incredibly questionable character. When Donald Trump spoke earlier about the United States terminating some of its funding or defunding the World Health Organization, Dr. Tedros shot back saying, if you want more dead bodies, cut the funding. This sounds like a mafiosa threat to me, Senator. What do you make of this, and what do we think about Dr. Tedros and the World Health Organization?
Well, what's remarkable, it's my understanding he's not a medical doctor.
Correct.
No.
He's a doctor of something. I don't know, doctor of philosophy. I don't know what it is, but he's not a medical doctor. What's a guy who's not a medical doctor doing in charge of the World Health Organization? That's pretty nutty. This is a guy who initially reported that the mortality rate from coronavirus was 3.4%. Nobody and any organization, no matter how paranoid they were, went along with his 3.4. It was just instantly discredited. Now the numbers from there went down to 2, and then they went down to 1, and then they went down to 0.4, and they continued dropping down. The mortality rate's nothing like what it was reported. And World Health Organization was just absolutely irresponsible. What they said was fake. It was unfounded. It didn't have any basis in fact. And I think there's very serious question. I don't know what we're doing with the World Health Organization. What is that organization? What the heck?
This guy is a crook. He has been all his life. His best friend is Bill Gates. The World Health Organization was a Depo-Provera scam that Bill Gates has been running. They've sterilized hundreds of millions of third world young girls. A lot of them have committed suicide. The second biggest funder of World Health Organization is Bill Gates. And those two criminals, there's this very special place in hell for those two guys to burn for a long time because they're bad news to a good hunting dog. And what World Health has done, hand in hand with Gates, that cannot be forgiven ever. And for Trump to come out and say he's going to defund World Health, that's one of those most positive things Trump said in a long time.
That's important. We go back to like the ICC, Senator Black, how corrupt that is.
Yeah. Well,
These
you know,
organizations.
I remember Bill Gates and Warren Buffett both came out and they said, we're giving away all our money. We're giving away to the poor. We're the beneficent rulers of the universe. And here it is today. They're twice as wealthy as they were before.
That's right.
That's right.
So they give some money to some of these ultra liberal causes. And it seems to me, maybe it's just a coincidence, but it seems to me that they're almost designed to undermine civilization. Things like the Common Core, which was Bill Gates' big.
That's right.
Common Core, the teachers hated it. They said it was just worthless. And what is a guy like Bill Gates doing coming up with the American educational system on the back of a napkin?
Yeah, exactly. And telling everybody they need a vaccine. Who is he?
Yeah.
I'd like to point your attention.
Family.
I'd like to point your attention to another friend of Bill Gates. I think, Senator, it may be possible that we slightly disagree on some of the details of 9/11, but this individual, I think, was very involved. He appeared on the Larry King show and mocked Rudy Giuliani, presented a check for $1 million to the city of New York that Giuliani rejected. I'm talking about Prince Al-Walid bin Talal of Saudi Arabia, an individual who seemed to become quite agitated when he was passed over in the hierarchy of royalty there. There have been a number of things that indicate that there's some sort of internal civil war going on in the Saudi royal family. A lot of people seem to think that the Saudi Arabian National Guard was involved in the Las Vegas shooting. Many people might recall that the Mandalay Bay Hotel, from which the shooting was alleged to have taken place, actually, some people may not know this, but the top 4 floors of the Mandalay Bay Hotel in Las Vegas are actually a boutique hotel inside the hotel. The Mandalay Bay is actually, Mandalay Bay, there we go. The top 4 floors are a boutique hotel. It's the Four Seasons Hotel within the Mandalay Bay, and the Four Seasons Hotel is owned by Bill Gates and Al-Walid bin Talal. There's a visual effects artist who has done a photogrammetric rendering of the hotel room, and he's matched it up with photography of Las Vegas outside the window. And it's amazing because when the 3D model is placed on the 32nd floor, the details outside the hotel do not match. Now, photogrammetry is an incredibly accurate process. When you move the 3D model of the hotel room up 2 floors into the Four Seasons, the background matches perfectly. There also was an attempt on Prince Mohammed bin Salman's life in Jeddah just slightly after this Las Vegas shooting, and we know that several members of the Saudi Arabian royal family, including Al-Walid bin Talal, were imprisoned in the Riyadh Ritz-Carlton and hung upside down. We also know that Al-Walid bin Talal was a close associate of Mujahideen Jihadi, not Washington Post journalist Mujahideen Jihadi Jamal Khashoggi. Many people suspect these individuals were involved in a coup plot, and that is why this unfortunate individual was chopped into tiny pieces inside the Istanbul consulate or embassy of Saudi Arabia, whatever it might be. Now, I don't condone chopping people up into little bits and sending videos of them to their family, but then again, I don't get involved in coup plots because I recognize that you've got some pretty significant exposure if they go south. So there's something very deep going on, I believe, with these individuals that fancy themselves the elites, the financial and academic elites of the world who look at us as ants who need to be basically vaccinated. A lot of people know that Bill Gates called for an RFID chip to be implanted in people's hands. He wants this chip to basically track your vaccination status. And of course, you know, his Bill and Melinda Gates Foundation has been funding not only the Pirbright Institute, which does hold a patent on a human coronavirus. He's been funding numerous pharmaceutical companies around the world to develop a vaccine. We know he funds technology of all kinds, but they want to put this chip in people's hands, which may or may not be mandated by the government, but it doesn't really matter because all he's got to do is get together with his buddy Jeff Bezos and make it so that you can't have an Amazon.com account or shop at Whole Foods if you don't have that chip. Maybe Al-Walid can make sure you can't bank with Citibank if you have that chip. But we're talking about a really small number of individuals who individually control, wealth that exceeds the gross domestic product of something like the everything but the top 60 some odd countries in the world. There was this bizarre interaction between Jeff Bezos and Crown Prince Mohammed bin Salman, where apparently a phone number exchange, according to Jeff Bezos, resulted in his phone getting hacked. Everybody heard about that. Naked pictures of Jeff Bezos with a woman who's not his wife, or being sent to a woman who's not his wife, or something like that, got publicized and ended his marriage. Of course, Jeff Bezos owns the Washington Compost, the bird cage lining rag that people can purchase to use as an alternative to toilet paper when it runs out. Am I talking to myself? It looks like you guys have frozen. Have I lost you guys? That's so interesting. Wow. All of our guests have been frozen out despite my high-speed dedicated fiber optic line here. I might be talking about things perhaps that people don't like. It looks like the computer froze. All right, well, let's see if we can bring this back here for a second. That's going to be quite an operation. That's amazing. All right, well, listen, not quite sure how to handle that. Let's see what people are saying here in the comments. It's very odd. I think what we're going to need to do is wrap it up for tonight. We're past our hour and we've got to crash on that computer. I'm so sorry to have my guests disappear like that. It was really a pleasure to have Senator Black with us tonight, and also Jimmy and JoAnne Moriarty. Of course, if people are seeing these guests for the first time, you can see them on the sponsor exclusive shows that we've done Unseen Libya with Jimmy and JoAnne Moriarty. The senator has been a frequent guest. People who are sponsors on patreon.com/crowdsourcethetruth or subscribestar.com/crowdsourcethetruth can get access to the full sponsor exclusive library. If you'd like to watch Unseen Libya, please sponsor Jimmy and JoAnne by going to patreon.com/James and JoAnne Moriarty, and you can learn much more about them there. I'm really sorry that we lost them, and it's going to require a lot of time and finagling to get them back. So we're going to call this the end of this show. I apologize to my guests for that untimely end, and I want to thank everybody who is sponsoring the show and making these episodes possible. Stay tuned tomorrow. I'll be back with more information, and of course we've got Dr. Corsi's Prescription for America tomorrow. Become a sponsor of Crowdsource the Truth and enjoy all these sponsor exclusive shows. Have a great night, everybody. Thanks for watching.